Good morning and good evening to everybody who's joining us today from different parts of the world. Welcome to our next webinar under the webinar series, COVID-19 Outbreak on the Frontlines, curated by the Harvard T.H. Chan School of Public Health, India Research Center, and Project SANCHAR. For today's session, we are glad to partner with the US Consulate General to bring forth an interactive webinar focused on mental health and COVID-19, coping strategies for young people. Before we start with the discussion, I want to give you a brief background about the India Research Center. It is the first global center of the Harvard T.H. Chan School of Public Health. Established in 2015, the center has three strategic goals of research, teaching, and translation of evidence into policies and programs. The center provides a platform to facilitate faculty exchange and partnership between public health researchers and Harvard Chan faculty. The center is led by Professor K. Vishwanath, who is Lee Kum Kee Professor of Health Communication at the Harvard T.H. Chan School of Public Health. Project SANCHAR is aimed at building the capacity of journalists to draw on the latest science and data for shaping public knowledge, attitudes, and policy on health. The US Consulate General in Mumbai, in coordination with the US Embassy in Delhi and consulates in Kolkata, Chennai, and Hyderabad, works to strengthen relationship between the United States and India. Now let's go on to our panelists. For today's panel, we are honored to have with us Professor Shekhar Saxena, who is the Professor of Practice of Global Mental Health, Department of Global Health and Population, Harvard T.H. Chan School of Public Health. We have with us Dr. Elizabeth Levey, Instructor in Psychiatry at Harvard Medical School. She's also a child, adolescent, and adult psychiatrist at Massachusetts General Hospital. We have with us Ms. Padmini Somani, Advisor, Narottam Siksaria Foundation, and founder and director of Salaam Bombay Foundation. And finally, we have the honor to have with us Ms. Dr. Nimesh G. Desai, who's a director, Institute of Human Behavior and Allied Sciences. The COVID pandemic has impacted us in different ways. For adults, it's about job losses and general anxiety towards the disease. For young people, including children, the lockdown has meant that they have been away from their schools, forced to take online learning, and also at times forced to be under violent family structures that is harming their health, social, and their material well-being. From our panelists today, we are looking to learning more about how young people can cope with their emotions in these times. Can they adopt few easy day-to-day mental health interventions to deal with the pandemic and general anxiety? So I'll start with you, Professor Saxena. These are unprecedented times. We are anxious, not just about catching the disease, but there are other uncertainties around social and economic aspect of COVID-19. What do you see the mental health challenges among young people and their coping mechanism in the context of COVID-19?
Thank you very much, Divya. I'm delighted to join this webinar. Pandemic of COVID-19 has affected almost everybody in the world. And the actual impact of the pandemic obviously is felt very strongly by many people who get infected. Some of them are seriously sick, and unfortunately there are many deaths. But almost all of us are facing the mental health impact. In fact, the aggregate of the mental health impact could actually be larger than the direct impact of the pandemic itself. The point I want to really emphasize is that mental health affects all of us in a variety of ways. So it's too simple to say that the people with mental health problems and other people who don't have. The world cannot be divided into two groups of people, one with mental health problems and others with not. So I would like to present, and in fact, I'll just propose to show a graphic where mental health has to be seen as a dimension. We are somewhere on this dimension at any point of time, and we also vary as the time passes on this dimension. We might be having good coping mechanisms. We have positive mental health. We might be having some mental distress. Some of us might be having a mental disorder, which can be diagnosed, and others might have a psychosocial disability, which is stable. And we fluctuate on that. During the current pandemic, and like many other humanitarian disasters, all of us move towards the right on this spectrum. That means people who are able to cope well find it difficult to cope. People who had a mental distress can go into mental disorder, and people who have a disorder can have a relapse and go into more disability. So that's the framework that we need to follow for everybody, and more especially for the young people who have less maturity in many cases and can rapidly escalate into more mental health problems. In fact, one should be reminded that 50% of all mental health problems begin before the age of 14 and 75% before the age of 24. And these problems are extremely common. So the point I'm making is all of us are affected and all of us require something or the other in aid of improving our coping mechanisms and also looking after our problems. What are the problems? As you said, this may be anxiety, this may be depression, this may be other behavioral problems, other emotional problems, and in many cases, overuse of substances, along with other symptoms like sleeplessness, physical symptoms like palpitation and other symptoms. And we need to be very carefully watching for that and doing what we can for that. Back to you, Divya.
Well, thank you so much, Dr. Saxena. I think it's a good foundation that you have laid for the discussion further. I would like to come to you, Dr. Elizabeth. The economic impact of COVID-19, this includes a global disruption to education caused by confinement measures, and the lack of distance learning solutions could potentially increase, not just illiteracy, but also child labor in many countries. You have specialized in research on trauma and child labor. In the face of pandemic, what are your observations on the impact of this specific issue with lockdown and the distance learning that's going on?
With lockdown and then also in the context of child labor, I mean, I think that, really the current economic circumstances are a setup based on what we know from the past, from, periods of, economic difficulty, really for it to affect the most vulnerable groups the hardest, which is always what we see. And I think for that reason, that we could see an increase in child labor for a number of reasons. With the economic pressure of the downturn, there can be more demand for low-cost labor across the economy. Families may also face greater economic pressure and not be able to afford to have their children in school and not working. And then the work of groups who are engaged in protecting children, just as the work of all organizations has been disrupted as people are having to move to working remotely. So I think there's excuse me, I think there's already a number of factors, economic factors that set up that risk. And then I think also with the lockdown and sort of the lack of a school environment to be a safe place for children and for the community to have a sense of where the children are, and for them to have a place to gather. Yes, I think it's really an area of concern.
Right. When we talk about mental health issues, we always sort of and this is most media and also perhaps in pop culture, it's sort of a certain class of people that are sort of perceived to have mental health issues. But Padmini, I would like to come to you here. This is the vulnerable class, the socioeconomic groups which never gets talked about is it's the underprivileged groups. And there you have worked so much with these vulnerable groups. What are the trends you're seeing in terms of the mental health troubles that is emerging in this section of people?
Thank you for that question, Divya. I think it's a very important discussion to bring to the table, because very often, the challenge with the vulnerable socioeconomic stratas is that the conversation tends to always stay around livelihoods and earning. And at some level, we at Salaam Bombay have always been trying to push the dialogue and saying it's not good enough to survive, you have to thrive. And the COVID environment actually pushed that clock back to a survival mode. And again, people are only talking about daily wage earners and not having the ability to bring food to the table, which became the biggest concern. But what it did do is, as a result of that, is it also pushed up that anxiety and the mental stress around the uncertainties of life that would have already, been around for these families. So in our experience, we've seen in the last couple of weeks that as the lockdowns in India kept, sort of progressing, the anxiety levels have also progressed with them. First, starting with the basics of earnings and wages, going on to then schools not reopening, the inability to go back to school, with many concerns. Like also what Elizabeth mentioned, there are concerns for being able to supplement family income or even just provide any basic income in the family. But going forward, it's a very important question. But I think the important challenge we need to put forward to ourselves, if you look at what Dr. Saxena has also tabled as the spectrum, is about the fact that what is the right time for adolescent and youth to really build that ability to face mental stress, right? Can you go into a stress situation and build the ability? Or do we as a responsible society need to go and question whether within our education system, we have a holistic approach to building resilience prior to something like this happening? So is it really part of our education system to start with at first, that adolescent and youth have the toolkit ready and available to build that resilience? So today, having worked in this population and having that ability to have been some part of that dialogue, we are comfortable to say that this is something that has to become a way to advocate for it to be a lot more holistic. And also the fact that at a time like this, when you have to intervene, to also try and support mental health issues within vulnerable populations, trust becomes a very important factor. So again, to be able to be already there and present, to be a trustworthy source for support also becomes really relevant in times like these.
Right, absolutely. But how do you manage to do that in a lockdown situation? I think this is a question we'll perhaps come back to. But I'll come to you, Dr. Desai. The lockdown means the lack of routine activities has completely stopped for children. We've had with school closures, there's been absolutely no physical activities that that kids have been able to access. This also has led to sort of issues of kids developing suicidal thoughts. Are you seeing this? Are you seeing this trend where kids are pushed to an extreme where they are thinking of taking their lives?
Thank you, Divya. Thanks for that question. Thank you for having me here, all of you involved, and great to be here. The first thought that I have, Divya, is that in mental health, a variety of groups and agencies have been trying for decades at least to try and not differentiate between us and them. Like Dr. Saxena said, it was not about us and them, it is about all of us. Sadly, this unprecedented situation is for the first time bringing that closer to reality and global social consciousness. Since most of us or all of us will be affected directly or indirectly, that whole idea of the field of mental health divided into us and them now gets blurred, if not entirely obliterated, which is a double-edged sword. But I do believe that human adaptation is actually much better than we might want to recognize. Within the vulnerable groups, the elderly, the women, the economically marginalized, and the homeless populations, and the kids and the adolescents. Kids and adolescents, while they do present with symptoms, kind of symptoms that you asked about, the adaptation is actually much better than we might anticipate. And so one issue is that we need to perhaps work on the positive mental health aspects more than necessarily only focusing on the disorders. Again, as Dr. Saxena said, there's enough research in India and outside to suggest that the priorities in mental health services in such situations ought to be: one, recurrences and relapses of those who are already on treatment; second, cases with much comfort which were hidden till now as part of the treatment gap; and three, transient emotional problems or suicidal tendencies, as you said. But certainly focus needs to be consciously made towards the left end of that spectrum of promoting positive mental health. encouraging adaptation. And to that extent, cross-cultural learning can be big help. Obviously, there'll be socio-economic and socio-cultural differences, and yet there is so much to learn from each other. Let me before I end also say that we work a lot with the homeless populations, mentally and otherwise. And in last 3 months, we have had an opportunity to work with huge thousands and tens of thousands of the migrant workers, who, as most of you will remember, came onto the expressways. And fortunately, as I am pleasantly surprised, their adaptation, as I keep saying, seems to be pretty good. The rate of psychiatric disorder or psychological distress in about 50,000 odd population that we have studied in Delhi seems to be at par with the general population. And so, as he said, in addition to the intelligence quotient and emotional quotient and the social quotient, maybe there is now really a need to focus on the adversity quotient and resilience of individuals, of groups, of families, of underprivileged populations with a positive direction.
Right. I think this is an interesting theme that's emerged on the resilience part of it. We will come to that. But I want to come back to you, Dr. Saxena, where we've seen that the lockdown has made it difficult, especially in countries like India, in several cities under strict lockdown, that people have not been able to access therapy. I mean, there is no access to normal critical surgeries per se, but there is absolutely no access to therapy or counselors. And because of this, you have seen a lot of people who want to seek help have turned on to social media. Is this something that can be used tactfully? You think perhaps in such a situation we need to sort of strengthen therapy that is delivered through social media channels?
Yes, let's examine that question against the background of where we were before the pandemic. And I must say that the mental health delivery system in most countries has been very poor. And countries spend very little money on mental health. The availability of mental health professionals have been very poor. In fact, I often say that when it comes to mental health, all countries are developing countries. So there is no country which has got it right. And India is certainly not an exception. We have very poor mental health services, especially for populations that is underprivileged, as well as in some way remote from the big cities. So against that background, the needs have become much higher and the availability has actually become much lower. So the gap between what is needed and what is available has actually enlarged several times. And we need to really pay attention to that. We need to provide a spectrum of mental health services, which start from very basic informal care, which can be given by people who are in the family or colleagues or other people, which is required in the large volumes, but actually cost almost next to nothing. And that can be available. And there I would like to point out that the often used phrase, social distancing, is actually a very unfortunate one. We should be saying physical distancing and social connectedness, which is actually very important, especially during these times. So that is the most important part. Everybody doesn't need a psychiatrist, let's be very clear. But we do need social connectedness and informal advice, which can, in some cases, be incremented to advice from the doctor or a nurse, who should actually be well trained to provide that advice. Just like when we have fever, we go to our general practitioner. We should be able to go to them if we have anxiety or depression. Unfortunately, their knowledge base is so poor that we often don't do that. And only in some cases, we need a specialist care by a psychologist or a psychiatrist. And that is something that is not available now because of the lockdown, because of restrictions, fear of infections, and so on. And there, I would say the silver lining of the current situation is that we have already proven that tele-mental health can have a major advantage. We knew that for the last 10 years, but we didn't do it. But now is the time to actually do it, not for all, but for a very large number of problems. Tele-mental health, including by people who are less trained, can actually be very effective. So I would very much suggest to policymakers and healthcare providers that they use these methods to their maximum effectiveness. Now, coming to your question about social media, that's only one of the platforms of electronic media, and that can be used, but much more. There can be some apps, and I must say that majority of apps are not evidence-based, but some good apps can actually be very helpful for providing self-care, group therapies, and other kind of things. So these are the methods which need to be used. And in effect, our system was so broken that we need to build back better. We don't need to build back what was there because that was anyway bad. We need to build something which is much better. And a disaster is really a very unfortunate situation, but we need to utilize that as an opportunity to build mental health system which actually provides services to majority of people who need that. Thanks.
Right. I think you rightly put out the whole aspect of social distancing has perhaps, made us, fall apart even further. And this and at a time like this, when we need more of support, family support, something that's completely lacking. And this is something that which we are witnessing even with the whole the disease management. One of the aspects of the disease is quarantining, and we are seeing that mass quarantine centers have been built, and there are reports coming in of people with mild symptoms or who are asymptomatic, who've been asked to, who've been put in those quarantine centers, have been facing absolute anxiety and depressing thoughts. Dr. Elizabeth, is there some way where we need to sort of now, put together a package while we are dealing with the COVID patients who are under these quarantine centers, where they're also provided with counseling and therapy sessions, which would make their stay perhaps much more easier?
So that's interesting. I'm interested to learn, more about what is going on with respect to quarantine centers. I was reading about that as a practice really in China when the outbreak started, but I didn't realize that was happening now in India. Yes, I think that and I think what's interesting with this population in particular, and I can speak to that and how that might relate to the experience in the quarantine centers, is that I think with respect to teletreatment for mental health, the young people, in my own practice, what I've seen really is that with young children it's difficult, and with adults it can be difficult, but the sort of high school, college age population, I think really they're comfortable on technology. It's very familiar to them, in some ways more comfortable, I think, than being in a therapy office. And so I think they find it easy actually to connect in that way. So I think it really, that making use of the technology now and creating systems to reach these patients is really an opportunity.
Okay. Padmini, we've seen that, again, the lockdown means schools have been shut. It's almost been 4 months that schools have shut down. This includes government schools. Our government has been proposing the policy of online education, but not everybody in India has access to laptops. There are kids who are trying to study using their mobile phones, and this itself is a quite downer for a lot of people, and doesn't have to be specifically clinical mental issue, but this takes away the whole determination that so many kids had with regards to education. What is your advice to such vulnerable groups? How can they cope in this situation? And do you have any suggestions for government, especially on the policymakers, that what should be they doing to address the whole issue of online learning for such groups of people who don't have access to a laptop or even an internet connection?
Divya, if you permit me, before I answer that question, I just want to add a comment to what Dr. Shekhar and Dr. Elizabeth have already said about telecalling. Mm-hmm. We actually did a very unique experiment over this time. We had a group of facilitators and teachers that we trained to start doing calls And we did about 9,600 calls over the last 2 months just to reach out to our adolescent and youth. And we called those calls happy calls. They were not distress calls. They were not calls where they were reaching out with mental health conditions. Many youth and adolescents don't understand when they are going through mental distress. They don't recognize it as something which needs help or that they can reach out to someone for help. So we did an outreach where we actually used to call our beneficiaries, our cohort, and we call them happy calls because the agenda of the call was to check on how they were doing, and the facilitator and teachers were trained to first call up and just ask after their well-being, and then to play some sort of a mindless game with them on the phone, just take their mind away and give them so that was the first part, was inquire. Second part was to interact with some game or activity, and the third part was to ask them what they would do while they would wait for their call to come back. So it was like a sense of a hope that someone's going to call me back, and now I have to have a plan. So what are you going to do to keep yourself busy? What are your hobbies? So giving them that thought process of what to do will eliminate mental stress. When you can't eliminate it, you can minimize it to some extent. So that was a process we ran, and it was a very successful experience because we realized that for many of these young people, they had not even been asked for weeks on end what they were feeling. And the ability to answer that question gave them a recharge to be able to go on a little further, to be able to do that. And this was done through telecalling on mobile phones. Now in India, the penetration of mobile is so high that even in slums, that is sometimes the only connectivity. In one family, you'd at least find a mobile phone. Sometimes it could even be a smartphone. Sometimes it might just be a basic mobile phone, but that access was there, and we had that database. There was a database which was already with us. So we used that access to try this experiment, and it's been very, very interesting for us to see the results. Coming to your specific question on teaching through screens, I think that has been a huge challenge for us because we've been keeping our classes on through the whole COVID period. So since end of March, we switched to online teaching, and we've been experimenting with all kinds of methods of teaching online. So I think first, the biggest challenge is to have access to a device that can give you access to the internet, which can then open that opportunity to get online teaching. And we've realized that in our beneficiary group, the numbers, of people who actually have active devices where they can access online learning is like only around 40%. So there is a large number of people who don't have phones which are as advanced, mostly phones. Very rarely will you find laptops or tablets in some areas, but phones are common. But only about 40% had smartphones enough to get a Zoom call or a WhatsApp video or something where they could interact beyond just a regular phone call. So that has been a limitation in itself for accessing online learning. But I think that going forward, if we can find a progressive way to give access, to giving, like, if one gives subsidies, one gives all kinds of, like, we're doing food distribution, we're doing all sorts of such support. We should think about data package support for vulnerable groups as a way to access the internet also. I mean, it's something that is worth thinking about as a meaningful support, because in India, obviously the cost of data is very, very low and reasonable. So it's a thought we can really build for vulnerable populations, to build access for them. We're also trying to do an experiment where we're asking sort of people of means to donate their old phones and tablets, etc., to pass in these populations, because many of us switch our phones around, after a certain period of time. It becomes an opportunity. Rather than selling it, can you donate it? And those kind of experiments can be done as social experiments to see how we can build reach. Many of the people who've even got cell phone access in slums have actually bought sort of second-hand, third-hand phones and upgraded them, with their own innovation. So those are all possibilities exist, but it's a real constraint to try to do online education, who will not be able to reach all the population. But yes, there is at least some population that can continue through that method. So we have to keep these things in mind. Even when we build policy for government on the way forward, we will have to think about how that's going to be to reach out to whole population.
Right. Dr. Desai, I'm coming to you with a very basic question. Perhaps we should have started with this, but I think this is something that a lot of people want to know and are often confused about. What is the difference between a therapist, psychologist, and psychiatrist? How can a friend, for example, help their peers who is in trouble or who's in need of help?
Sure. It's not too basic a question really, Divya, because I remember reading in Punch magazine a couple of decades ago, or more than a couple of decades ago, one cartoon about the same question. On the airline, passenger asking the other person, what's the difference between a psychiatrist and a psychologist? So that's cool. A psychiatrist is a medically trained person who then specializes in psychology, human behavior, application of pharmacology to mental health problems. And so while he or she is equipped for counseling, therapy, also dispenses medication, can see the overlap between medical illnesses and psychological issues or psychiatric problems. And that's important. As you were hinting in one of your questions earlier, one of the major issues right now is also people with pre-existing medical conditions who might have problems in lockdown in accessing services and or develop mental health problems. And so the overlap between medical illnesses and mental health problems. A psychologist is essentially a humanities graduate and a postgraduate with an MPhil or a PhD who will then specialize in clinical applications. A therapist in the Freudian sense was a person who had undergone 3 or 5 years of personal psychoanalysis and then certified to be a therapist. But that's kind of become more pragmatic. Brief dynamic and brief behavioral therapies are on. A counselor really could be any of this or merely a lay or a peer counselor who gets a few weeks or a few months of training to deal with the lower end of the prism of problems. Now, the important part is what you're raising, Divya, is also that for me, it's always been these 4 levels. Self-help, as was alluded to. If I can help myself, very nice. If I need next level, friends or immediate family members who can help me. So a friend could be a counselor, informal or semi-formal. At 3rd level, if a friend or a family member is also not able to help and the distress persists, then yes, I might go to a mental health professional, not necessarily a high-end qualified specialist, but a mental health professional. At level 3 only, as was said, you need really professors of psychiatry and clinical psychology. So the 4 levels of mental health care service delivery that's possible is actually a huge model to follow all across the world, as I said, but certainly in countries where there is resource crunch in terms of human resource for mental health. There are very few psychiatrists and psychologists in large parts of Afro-Asia. And so the one issue is the cost being less. The second is the easy accessibility. Third, and the most important, is that the confidence building, if I help myself, or if I just seek help from a friend or a counselor instead of going to a professional, it has a lot of positive issues in terms of my long-term recovery and adjustment. When all is said and done, there is that stigma that's going to take a while of going to a psychiatrist and going to a mental health center. We certainly want to encourage people who should be going there, but we would like to perhaps decentralize the mental health service delivery system, and take it down to the levels possible.
Right, right. So just a reminder to all our audience here, we will soon be taking questions. So now is the time that you start putting your question in the Q&A box. And before we start the Q&A, I'm going to come to all the participants with a very fundamental question. What would be your advice to all the young people, young adults who are under this deep anxiety of not just the pandemic, but what's going to happen to their future with school shuts, classes going online, some young people who are just getting into the job market? What would be your advice to those people who are, and I think it's also for all of us who are listening here, what would be your advice to cope with this current crisis? We will start with you, Dr. Saxena.
Yes, very important question. What should we do? How should we cope better? And especially if one is a young person, which I am not, but I can certainly advise a little bit. I think the first issue is to be able to recognize that this is a very major stress on the whole society, and we are going to be affected, and to really be prepared for that, and to recognize that we are not alone. Everybody is having problems. And that really takes the edge off, because otherwise you think you are the only person who's suffering. In this case, you're not. So that is one. The second practical advice I have is to keep a tab on one's own emotional state. Just like when we count our calories, or we count our steps, or we look after our physical health, we need to be really ready to count and assess our mental health, our emotional well-being, our stress level. And that can be done just by thinking about it, or taking a very short questionnaires, so that we are aware as to which situations are troubling us more, what is the real cause, what are the other possibilities, and so on. My third advice is to actually be grateful for small things which are positive. There are too many negative things around, but we are still able to do something. We are able to maybe take an online course, we are able to do something positive, and to really pay emphasis to that. There is too much negativity around. Let's find something which is positive and prepare ourselves for that. And my fourth advice is, when you take a positive step, however small it might be, you make progress, you attend a good class, you are applying for a job, really feel that that is something which is gratifying, which is something to be proud of. Because otherwise we go into the spiral of anxiety and a spiral of depression. So we need to really condition ourselves to say that something is better than nothing. And we pay attention to that. And we do not only for ourselves, but we do for others. Right. Others who are nearby, your family, your colleagues. Really respect them for that, for what they're able to do. And pay attention to your own successes and their successes, however small that might be. So these are four very specific suggestions which will prepare us well.
Thank you, Dr. Saxena. Elizabeth, quick advice that you would like to have, that you would like to share for the audience?
Yes, thank you. So, I think I agree very much with Dr. Saxena is saying, that this is a time that is difficult for everyone and there's no way around it. And I mean, I think it's difficult for different age groups in different ways. On the one hand, young people are fortunate in that if they contract the virus, most of them have a mild course, most of them are recovering. They're not at such a high medical risk. But I think in terms of the quarantine and all of the other impacts, I think it really takes a particular toll on young people, actually. I think people at transitional points in their life are really, impacted in a greater way than those of us who are able to sort of continue what we were already doing in a modified way. I think the introduction of so much uncertainty is really destabilizing for young people. And so I think for young people to recognize that, and for those who support young people in their work, for teachers, for parents, families, to recognize that this is really a greater challenge in many ways, that sort of what's needed in terms of the public health response to this is really a greater challenge for young people. I think because, their sort of emotional investment, their world is not in the home in the way it is like for adults and for young children. I have two very young children at home, and they, in many ways, I think, are happy to have their parents at home, all the time. So it's a different experience. But I think kids and young adults, it's really challenging because their emotional investment is in their friends and their peer group. And so to be deprived of that, I think, is really difficult. And so I think that, for families to be aware of that and to recognize that it's a difficult time, because I think, as Padmini was saying earlier, even when we can't fix it, we can't change the situation, but recognizing how somebody's feeling, giving them a chance to voice that, I think, is really powerful. And then I think for all families, of all ages, what I've been recommending is really just about both routine and flexibility. Having, it's hard because the usual things that create a routine in your day have been disrupted. But coming up with a schedule, waking up at the same time, bathing every day, having a regular schedule of meals, doing some physical activity, whatever that is, having some social engagement, also having some alone time, sort of in a more intentional way, creating the kind of structure that sort of external factors would ordinarily create for you, I think is really important.
Right. Our Q&A session is buzzing, but I want to take quick pointers from you, Padmini and Dr. Desai, so that we can, and there are really interesting questions that is coming in for all the panelists here. So Padmini, quick tips for kids out there.
Sure. Just some quick ideas which we ran, which again, I'm giving just as suggestions. One of the things is that while, we're accepting to let adolescents and youth say that they're not feeling good, and that's okay to say you're not okay, you're also trying to think about how you change that discussion or discourse in their minds. So one of the things that we've experimented with, of course, over the months is to try and give them an avenue to be part of whatever needs to be done now. So try to really ask them, what can you do right now to make a difference? And one of the things that has really helped is, of course, peer-to-peer calling. So them helping their friends by having a conversation. Second, which has been very encouraging, is we actually used our network of youth to become reporters for a radio station to do zip code reporting on what was going on in their area. Today there was a lockdown again. Today we had so many cases of COVID. Today we had a problem with the cops. We didn't get food today. The water system was, whatever that was. And because of that, they were very aware of their issues, but they also started feeling empowered that they were actually the voice that was taking, that whole self-efficacy, response efficacy kicking in and saying that I can really be that part of that change and bringing that voice out. So some of those ideas of trying to see whether they can really be part of that system. So even teachers enabling their students to do things with communication, giving them opportunities, ideas. And I really, all the points that both Dr. Shekhar and Dr. Elizabeth said are very, very important, finding routine and all of that. One of the things we realized is that in vulnerable populations, that family bonding didn't exist. So what we started doing is, for our online classes, started inviting the family to join in. So whether it was a class on music or dance or sport or financial literacy or English language or whatever the class was, we would tell the parents to join in. So there's been a lot of bonding that has happened through that opportunity to do something between the adolescents and their parents as well, which is very important at this time. Here are just some quick suggestions.
Right. Thank you. That were really helpful. Dr. Desai, again, 2 minutes before we get on to the Q&A.
Yes. In addition to all that's been said by my friends, one, and most important, give yourself and give everyone around the latitude of almost any reaction. As we are very fond of saying for the last few years, and now this pandemic is actually proving that true, almost every reaction be seen as a normal reaction to a situation that is grossly abnormal. And so not to judge any reaction or behavior pattern too early or too quick. Two, as I think Padmini has highlighted so well, just to emphasize that one more time, constructively channelize the energy and the restlessness that youth and the kids have. One-on-one, helping each other, helping the society, helping the larger cause. Three, use popular wisdom, local, culturally available popular wisdom. Use the social media. Use the social media for spreading positive stories and positive vibes. I'll stop there for now.
Right, great. Thank you so much. And I think now we'll open up for questions. There are really, really interesting questions here. The first question is, there is so much uncertainty and every day there is a new update regarding exams for final year students. We cannot even withdraw ourselves from social media because a lot of updates come from there. How can we cope? How can we cope with this? This is from a student here. Who wants to take the question first?
I'll take a shot at it.
Sure, sure.
So I think what we always suggest with even our youth, those who have access to media, it can also be a real problem because we are getting so much feed of information all the time. I think one of the things is also to encourage young people to have a mental discipline to not go and look at every single WhatsApp forward and all the news beyond a certain point. You have to tell yourself that I'm not going to do more than 30 minutes of Corona time or 15 minutes of Corona time. It's just call it that, look for the news you need and then move on to something else. Because honestly, that's also dragging all that anxiety and all of that. It's not helping. And that information is just the same, which is being churned, and also a lot of misinformation and panic. And so it's actually quite a negative experience. So it is important to encourage young people to not depend so heavily.
Okay. I think Perhaps.
On that. And I do know that this anxiety of the exams and everything is really
Right. I think, Padmini, we lost you a bit out there with the connection, but it's all right. We'll come back to you. There is a specific question for you, Dr. Saxena. Could you tell us at what specific age are young people most likely to develop mental health problems?
Thank you, Divya. A good question. As I said earlier, 50% of all mental health problems arise before the age of 14 and 75% before the age of 24. So it's the young adults and adolescents who have the maximum chance. So I would say it's between the age of 11 and 24. That is the maximum period. And that is explainable because the brain is developing the social connections and other things during that time. And the person is evolving from a child to an adult. So it's obviously a period of great change. And that is also the vulnerability for that. If I can just answer another question, very interesting, which I read, which is about the use of social media and other electronic devices. How much is good and how much is bad? That's a question that I'm often asked, and there is no clear and ready answer. It depends on what you're accessing and who's accessing that. So that is what is important. During these times, one understands that one is accessing more of the electronic media than otherwise because one is more confined at home, and also there are things that you need to know. But I fully agree with the earlier comment that it can be a vicious cycle to really keep going on into the news cycle every day, every hour, sometimes every minute. And it becomes really a spiral of negativity. So we must avoid that. We should be disciplined. We should think about how much we're accessing and pay attention to negative, but also to positive news, which is there somewhere, maybe buried, but we do that. In fact, WHO has called this the infodemic,
right?
Just like the pandemic.
That's
so there is a lot of fake news, there is a lot of inaccurate news, there is a lot of scaremongering. We should really avoid that because that is going to create problems for us and the people that we forward our things to them. So no hard and fast deadline about how much to take. It depends on people. With the same amount of screen time, some people will benefit and some people will actually be harmed, including, let's also remember, the kind of bullying, cyberbullying that takes place, which it can be very harmful. So let's, as parents, let's look after the mental health of our children and at least know what they are visiting, what they are accessing, and keep some kind of moderating influence on that. Thanks.
Right. The next question is for Dr. Elizabeth. This is very specific. My friend has anxiety attacks. What can I do to help her while staying at home?
So I think, it's a question of, I think as Dr. Saxena's diagram at the beginning gave us a sense of really, figuring out whether you can help. And I think that's sort of one of the challenges in this time is figuring out, how much help you can offer someone as a friend and remotely, and when to, and when it's really too much and to refer on. I think, I think people who tend towards anxiety are having more panic attacks now. It's happening. I think, one of the things that is difficult with a panic attack is if someone's never had it before, they're worried that they're having a heart attack or that they're having some kind of medical problem. And so if they don't know, then sometimes that can add to the fear. So it's hard. It's it can be. I think it can be a difficult thing actually for friends to help with. I think as a friend, you can make yourself available for regular contact, but also figuring out how to take care of yourself because everyone is under this strain. But I think just being there, knowing that you're there, talking to the person and reassuring them. And if it continues, if they continue to have this problem, I think probably the best thing you can do is to help connect them with a therapist or someone who will be able to help them.
Right. This is a question again for all the panelists out here. This is a question related to specific profession. How do medical students who are in the thick of the pandemic deal with mental stress? Who wants to go first? Hi, did you get the question? I'm sorry, did I get cut?
Will you repeat that one more time, please?
Sorry, so the question was how do medical students who are under thick of the pandemic, who are in fact dealing with patients, who are taking care of patients, deal with the mental stress?
I think I can take a first shot on that. In fact, the Harvard Chan School, which is sponsoring this webinar, is really actively involved in initiatives. One of them is called First Responders First, which is looking at the mental health and well-being of healthcare providers, including doctors, nurses, and also students who have suddenly found themselves in the middle of the COVID response, sometimes very unprepared for that. And the anxiety and the depression is actually very, very obvious. Also, let's remember that medical students and other people who go to the hospitals have a much higher incidence of COVID infection. In India, I read a report that a couple of 100 doctors have actually died because of COVID, which is a serious professional hazard. And sometimes they bring infection back to families and their relatives. So these are real issues. And I would say very clearly that healthcare providers need to look after their own mental health and well-being much better, because if they are themselves not looking after their mental health, they will not be able to help others. So just like the airlines, when they say, put on your oxygen mask first before you put it on somebody else, we need to really follow that as medical professionals. And there are many resources available. Let's find some time for them so that we are just not heading into a complete mode of helping others. Let's help others ourselves also.
Right. Anybody else want to take that question?
Sure, I can speak to it as well.
Sure.
Divya, I'm not too sure if I got the question really well, but I've been itching to say this anyway. For any counselor, any friend, anybody who wants to reach out or is approached for help, I think there are too many questions in the chat box and in the Q&A that talk about the real life problems of the lockdown, of the epidemic, and the economic slowdown. So my predominant thought in the last few minutes has been, while giving first aid, while giving help, while giving hope, recognize, just like I said about reactions being normal, in anybody who is trying to help, recognize that whoever is talking about the suffering is actually, the suffering is very real. Mm-hmm. Universality will help. I'm not the only one. There are a lot of other people suffering. Sure, that helps, as was said. But by no means, directly or indirectly, should we even get the idea, let the person get the idea that the suffering is being trivialized. Because that's one thing that in such situations can be terrible. So, genuine recognition from people around and helpers for the huge distress that human race is going through, and some individuals and some groups are actually going through it much more than the others.
Right. So this is again question for all the panelists. I'll start with you first, Dr. Elizabeth. This is what advice would you give to persons who are living with or who are caring for people with mental health or mental health challenges? How do you handle your own stress level as a caregiver, your guilt and the fatigue that comes with it? Dr. Elizabeth, We'll start with you.
Yeah, yes. I mean, I think that, you know, it's something that I think is always a challenge. And now, you know, in these times, you know, people are short on time. They have more responsibilities in terms of work and caregiving. And so I think it's even more important to not neglect yourself, and to think about things that you do that you enjoy, even if they're small things, and incorporating them into your day. And I think exercise really goes a long way, and finding ways to connect, finding ways, if you're the support person for many other people, finding someone who it feels good for you to be connected with, and making sure that you keep up those connections, because you're doing it for yourself and also for the people that you're taking care of. Because if you're not doing well yourself, you can't really be that support person to those people. So I think sometimes people find it harder to make time for themselves, but it's actually so important.
Right. Padmini, do you want to add to that? What about the caregivers who are taking care of people with?
I think it's very challenging, and in these circumstances, it's even more challenging. I think I'm not an expert to give advice on this, but the only thing that I can suggest is that to be able to find a way to recharge your own self in dealing with whatever you're dealing with, you know, whether it means being able to get out and do something for yourself, like a walk or some time on your own, I don't know, meditation, something which allows you to keep yourself also centered. You know, it's a very, very difficult ask in these times.
Sure. Professor Dr. Saxena, your advice for caregivers, because they're such an important part of this entire element that never get talked about.
Absolutely. In fact, I would just like to reiterate what Padmini said. You know, you don't need to be an expert to give advice. I think your advice is absolutely right. That while caregiving is important and you are serving a great cause, just remember that your own mental health and well-being is equally important, because if you didn't look after that, your caregiving function will eventually suffer. So I think it's very important to take time out for oneself, recognize one's own stress, talk about it, take gratification in what you're able to do, count some small gains, and derive pleasure out of that. Don't discard pleasurable activities. Don't feel guilty that you are taking time for yourself. That is extremely important. And there is enough literature on that, especially from care for people with dementia. There are many studies which suggest that caregiving is a very tedious task, it's a burdensome task, and people need help to be able to do that well. There are some great examples of that. WHO has also a website which actually suggests those ways. It's for people with dementia, but it can be equally effective for many people in the present circumstances, looking after a variety of other caregiving tasks.
Right. We have 3 minutes, and this is the last question I'm going to take. And this is again for all the panelists here, a very, very important question, I think, personally. How can we teach empathy to adolescent children when they are themselves in the whirlpool of their emotional rebellion? Is there a way to teach empathy? Dr. Desai, we'll start with you first.
Yes.
Is there a scientific way to teach empathy?
By example.
Okay, by example. That's nice and short. That's okay. Fair enough. Padmini, how do we teach empathy?
I think it's tough to create an environment where you can experience it. I think that's when you have to be able to experience it and then call it and talk about that as empathy, as a value. It's very tough to otherwise do it as a teaching moment. It has to be an experiential learning, and many of these things have to also be learned, I think, at younger ages, and later on they just get reinforced. I think that all of us have the ability of empathy within us, you know, but we have to realize it, and that ability to point it out through that experience is what will make the difference.
Right. Elizabeth?
Yes, I think by example is very well put. I think sometimes people feel like they need to kind of deprive children or expose them to difficulties for them to be able to empathize with other people in difficulty. But actually, it's by by having somebody empathize with them, especially when they're young, and really having the experience of being cared about, that they learn to transfer it. And then I think, yes, as they get older, kind of having that example reinforced. So I would agree.
Right. Dr. Saxena, you have the last word. How to teach empathy?
I think what has been said is really very, very important, by example, but also by creating the opportunities for people to feel that. I would say that by talking about it, and also by exposing them to situations and other people who are even more vulnerable, can actually help, because that includes some positivity, and that can really be very helpful. So
Right.
Thanks.
So we are perfectly on time. It's 7. Thank you so much for all of you for taking time out, and all the audience who've been sending us these excellent questions. We're all going through difficult times. We all are facing internal battles among ourselves in some way or the other. I hope this session sort of brings us closer to each other and know that we are not alone. So seek help, talk to your friends. I think we'll be fine. Thank you so much for all of you for joining.